I'm Tom Suspenski. I'm owner of Health Check Physical Therapy, located in Downingtown, Pennsylvania. I've been involved in physical therapy for the last 30 years. Often I get patients who come in and they ask me about different issues related to their back. There's a lot of different types of diagnoses that people can have with their low back. And the biggest issue today that I face with my clients is people always asking, how can I be seen without having an MRI or an X-ray? Because I'm real concerned about the cost of my insurance. A lot of times people get sent down paths where they have to order a lot of X-rays, a lot of MRIs. It becomes quite costly, but they never get to the root of the problem. They're looking at often structural problems in the spine that cause back pain. But there's also some very functional reasons why they have back pain that can be corrected through proper manipulation or mobilization of a joint, as well as active exercise. And it certainly beats, the alternatives, such as, getting injections or surgeries that you see often done today, maybe to the fault of having too many surgeries being done. Because the outcomes aren't always that great. Surgery isn't always the final fix. A lot of people come to me after they've had surgeries and are still having problems. So what you want to do is make sure that you get properly diagnosed and in an efficient and effective way that doesn't burn a hole in your pocket. Probably over 50% of what I see is low back and neck problems. So today I'm going to focus in on low back problems. And what we basically talk about when we talk about the low back, we talk about the pelvic girdle, because that's really the keystone of the spine. And the way that works is here's your hip socket on one side and your hip joint. Okay, they call that the right ilium. This is the left ilium, and that comprises your hip socket over here as well. And it's separated by a triangle bone called the sacrum. And the sacrum is really the keystone or the foundation for the spine. If you don't have adequate positioning of that sacrum, it can often cause problems above, in the vertebrae above, because the vertebrae basically sit on here just like this. They sit on here just like that, and as you see, the spinal cord goes right down through there, and it draws out a branch of spinal nerves that come down along. Some spinal nerves go down the right side, or the left side, and then down the right side, and they supply the nerve supply. So it provides sensation for the legs. Also, it affects the muscles. It sends the messages to the muscles to provide strength for the lower body. But what you need to know with the spine is that you have to have everything in the proper alignment. So when people come in for physical therapy, and a lot of times I often ask them, have you seen anybody else for your back pain? And often they say, I saw an orthopedic doctor. He gave me some anti-inflammatories. Did they give you any exercises? Well, they gave me some exercises from a prescription pad that a pharmaceutical rep left. Or they'll say, or they'll have gone to a chiropractor who manipulated the joint, and they said, they felt good for a couple days, but then after a couple days they started to have recurring pain, and the chiropractor says, just come back and I'll just keep adjusting you. Neither one of those approaches really takes care of the problem overall. What you really have to do is you have to look at what's not moving properly, and then you have to fix that movement problem, and then you have to try to affect those structures that are basically causing that pelvis to go out of alignment, that are causing those bones to move out of alignment. So if you've gone to a chiropractor and the chiropractor says, I adjusted you, you should do fine. If you're not getting exercises to address the muscles that are creating that tension on those bones, that put those bones out of alignment, then you're not getting the complete treatment.